Lord Winston, thank you for coming on our show today. Now, the NHS is never out of the headlines at the moment, and the thing I wanted to start off asking you is how big a crisis do we find ourselves in today when it comes to our health service?
I think it's a very real, very serious crisis. I don't think we've settled him. I qualified in medicine in 1964, and there's never been a crisis like that since. And I think it's a bit like a battle. You know, when you start to lose control of the battle, that's when it gets really bad. And what's happened now, of course, is the government's actually lost control. What
do you mean when you say they've lost control?
Well, when you have ambulances queuing outside hospitals, when you've got people dying unnecessarily, unfortunately, when you see people with heart attacks and with cancer not being treated on time, I mean, that is actually losing control of healthcare.
So when Keir Starmer says he thinks it's the worst crisis in the NHS's history, he's not making a political point, you don't think? You think that that is the truth?
I'm sure. And, you know, I know I sit on the Labour benches in the House of Lords, but, you know, really, I see myself really as more a crossbench in mind. But, I mean, Keir Starmer's absolutely right. He's completely trustworthy. And I don't have any doubt that really what he's saying is really from the heart.
And Lord Winston, the government, you know, I talk to ministers about this and to Number 10 about what's going on. They often talk about the legacy of COVID, that has compounded the problems, that's created these huge waiting lists, people not going in to see doctors during those 2 years where the pandemic really absorbed the whole attention, not just of the country, but the health service, obviously. That there is some truth in that, isn't it? It's not entirely...
I would put it a different way. I would say that the government have been incredibly lucky with COVID, because actually, in fact, this, in fact, gave them a perfect excuse not to do things, and they've been sitting complacency while this has been going on. So COVID has directed everything. And actually, this crisis was inevitable without COVID. There's no question about that. It was absolutely clear.
Okay.
If you look at the graphs of everything going up, they're going up almost in a linear fashion. Waiting lists, ambulance problems, people dying, people not getting diagnoses, right the way through for years before COVID. So this has been a long-term problem, and it's been going on at least for 10, 12 years, probably longer. And it's been clear that there has been massive underfunding of the health service.
So, Lord Woods, just to be clear, your view is that COVID has given the government cover to blame underlying problems?
No question. And in fact, don't forget, they were warned about COVID. We had the select committee I sit on in the House of Lords, at Science and Technology, had repeatedly pointed out there was bound to be a pandemic. When
Keir Starmer then says, I don't want to talk about funding, that is dishonest, isn't it? Because isn't that partly what a political leader should talk about? And it is disingenuous to say it's all about reform, it doesn't need more money.
I'm not prepared to say that Keir Starmer is dishonest. If he says I'm not going to talk about the funding, it may be because his views on the funding are currently fluid.
Right.
And in fact, I think that actually we should have that fluid view. And I think that's reasonable. And I think, in fact, if we ever get round to having a cross-party agreement, it's not going to come very easily, because neither side is going to want to sit down like this, because actually whoever does this could lose a huge number of votes. But actually we have to start thinking not politically, but actually in terms of what really is needed. And that's a very big difference.
Sort of thinking the unthinkable,
yes, if you like. Look, we know from the First World War, if you fight a battle politically, you lose it. And that's what the politicians did on both sides. Large numbers of lives were lost on the German and the English side because the politicians were trying to direct the war. And actually, this is the same sort of thing. We've got to really look about what is really needed in terms of managing a proper healthcare system.
Do you personally think that the NHS does need more resource and more funding?
Yes.
People are scared about talking about this, aren't they? Because they're wary that reform is code for diluting the principle of the NHS being free for all. This is a political issue, isn't it, in that sense?
It's an issue we should deal with some humility, isn't it? That's really what we need to do, and actually recognise that nobody has a perfect answer. But actually, one thing we could certainly do is to look at systems which are better than our NHS. You know, for years we have boasted that the NHS is the best healthcare system in the world. Doctors will tell you that it's not. The doctors who go outside this country, and many of them do, I've worked in the United States, I've worked in Europe, I've had jobs in Belgium, for example, I've been in the front line in other countries. And actually, there are many examples across Europe in particular, but also elsewhere, where in fact there is better care than we're giving. And we have to understand ourselves, what have we done that could have been done? What do we do now to try and do that? It means a change in the way that we do things. It doesn't mean to say that we don't want to see healthcare for everybody. Of course we do. That is a reasonable, proper entitlement in a good democracy. But it needs to be done fearlessly, and it's going to have to be very difficult to do. I don't doubt that.
Lord Winston, I actually interviewed Sajid Javid, the former Health Secretary, at the end of last year, and we touched upon this, and he said, we need to talk about the funding of the NHS. And then I said, well, what particular model do you like? France? Do you like Germany? What are you looking at? And he didn't want to discuss that. And he basically said that no one can talk about this because they are shouted down. I think you're saying that that needs to end, but do you accept that that probably cannot happen until after a general election?
You know what? That's what happened to me in the year 2000 when I was shouted down by Alistair Campbell. And Tony Blair came back on the phone and said, you know, you're quite right, we're going to increase the funding. And he did, massively. And of course, Blair had a very large majority. May well be that the next government will have a very large majority.
Is this a call to Keir Starmer, then, in a way, to kind of show some
Yes,
courage?
I would love to talk to Keir, because I have a huge regard for him. Now, at the moment, it's very clear that this government is burnt out. So there's every reason why we should be thinking about what we would do if we did have a massive majority and start to try to persuade them.
You talked about other countries use hybrid systems of public funding and private insurance. Is that what you think the UK needs?
Well, I'll tell you what, you know, had we done what I wanted when the Labour government was in, to really bring private practice into the NHS hospitals so that we had not private clinics in Harley Street, but private clinics actually in our main central hospitals, and really where consultants no longer had to drive out to a private clinic, but would go next door, and you wouldn't have a differential treatment because they wouldn't treat patients differently. But there are still hospitals where that happens, for example. But on the whole, it doesn't really happen very much. And a huge amount of income has been lost as a resulting consequence because of a dogma associated with private practice.
Just in terms of other areas of reform, because Labour are talking about reorganisation, Keir Starmer has suggested more self-referral. Now, you are you were a practitioner, you're an expert. Do you think that's a good idea, that people self-refer? Is that just time wasting because it's unwise referrals?
I think it's
he
something.
Said people with self-bleeding. Internal bleeding could refer. Well, I mean, don't you need to go to A&E if you've got internal bleeding?
Well, I think it's difficult to understand quite what he meant. But I mean, if he meant that, you know, just being aware of symptoms earlier and then doing something about it, I would agree with that. If you mean self-referral in terms of how most doctors seem to perceive it, and you saw them on the news, they were horrified. I'm not clear quite what he had in mind there, to be fair, and I think that's quite important too. But we should have more healthcare information available, and I think we do need a more robust primary care system, and at the moment that's not adequate either. So, for example, we have very good general practitioners, but more and more people, as soon as they get to a reasonable age, leave. So the loss of retention of workers in the health service is scandalous, and it's because of the very poor circumstances and the fact that they're not actually not being listened to.
Well, actually, I might as well bring this up now. I mean, now you've brought it up, just quickly, I don't want to make this into a news interview, but nurses pay, doctors pay, ambulance workers pay. Does the government need to move on this?
Yes.
You think they do?
Of course. We're not paying nearly enough.
And is that affecting retention? I mean, what about the argument about inflationary pressure?
If a nurse can walk out of an NHS hospital one day and walk into a private clinic the next day with an increased, not only increased salary, but just better working conditions, being treated in a more human way. I mean, but having working hours which are acceptable and being able to work part-time, perhaps, whatever it might mean. I mean, we've not been that flexible. We've been better at that. But if you talk to, well, you saw the nurses on the news yesterday. It makes you cry to see them crying, to see them shouting and screaming in that sort of way. That kind of angst, that is not usually shown by nurses. And doctors feel that just as much, but they probably don't say it quite so loudly. I think there's been a great deal that could be done with pay. Certainly, the pension reform is really urgently needed. That's clearly iniquitous. But there are other things that could be done as well. Yeah, I think we have to pay people what their value to society is.
And we value the NHS greatly.
And we value the NHS greatly. That means that we have to actually consider what it's really worth to us.
And Lord Winston, Labour this week also revealed figures showing that 37,000 people with conditions like heart attacks or strokes, a category 2 call as it's described, waited more than 3.5 hours for an ambulance in December. I mean, what happens if, what happens? I mean, I don't know, but if you have to wait an hour for an ambulance and you've got a suspected stroke or heart attack, what happens to that person?
Well, you lose part of your brain, which dies, possibly, and of course you then have irreparable damage, so you are a much bigger cost to the health service the rest of your life, which may be diminished, of course.
So when you see those ambulance figures...
It's not saving money, it's actually costing money. It's actually costing money to keep stroke people waiting. Nobody's ever said that before, but it's obviously true.
Well, so just to finish off, and thank you for spending so much time talking to me, but what's your message then to political leaders right now? Well,
I would like to just hear honesty, I think. I'd like to see honesty at the dispatch box, and when they're asked questions, we're not getting that enough. I think we all have to be honest, because nobody has the answers. And I think we really need a degree of humility. We can't keep on boasting about healthcare. There are pockets of really fabulous stuff going on. At the moment I'm under the care of Moorfields Hospital, seeing 2 different consultants as an NHS patient, and they're brilliant. You think this is world-class stuff. It is, but the support for them, because of the paperwork and so on, is really not adequate. And you feel it's so shocking that really we have these pockets, but the health service is not delivering what it could do, and that needs really careful reorganisation and the use of better data too, better data management.
And you would, and as a private citizen, a person that's worked in the NHS that's given so much to this country in terms of innovative healthcare, you would pay more tax for a better NHS?
Of course, no question.
OK. Lord Winston, thank you so much. It was a real pleasure and honour to meet you, so thank you so much for coming on the show.
Thank you.
Thank you.